Another day, another story. Complication of UTIs. Urinary tract infections, UTIs, are usually not serious and can be easily treated. With antibiotics, they can lead to complications in some cases. Some potential complications of UTIs include kidney infection, pyelonephritis. If a UTI is left untreated, the infection can spread from the bladder to the kidneys, potentially causing more severe symptoms such as fever, chills, and back pain. Kidney infections can be serious and require prompt medical treatment to prevent kidney damage and other complications. Sepsis. In rare cases, a UTI can lead to sepsis, a potentially life-threatening condition, in which the body's immune system overreacts to an infection, causing inflammation and damage to organs throughout the body. Recurrent infections. Some people may experience recurrent UTIs, which can be uncomfortable, and may require long-term treatment to prevent future infections. Pregnancy complications. UTIs during pregnancy can increase the risk of complications such as preterm labor and low birth weight. Permanent kidney damage. In rare cases, UTIs that are left untreated or poorly managed can lead to permanent kidney damage. It is important to seek prompt medical attention if you suspect you may have a UTI, or if you experience any of the above complications. With proper treatment and management, the risk of complications can be minimized. Recurrent UTIs. Recurrent urinary tract infections, UTIs, are defined as 3 or more infections within a 12-month period, or 2 or more infections within a 6-month period. Recurrent UTIs are common, and can be frustrating and uncomfortable for those who experience them. Some potential causes of recurrent UTIs include reinfection. Bacteria from a previous UTI may not have been completely cleared from the urinary tract, leading to a new infection. Antibiotic resistance. Repeated use of antibiotics to treat UTIs can lead to antibiotic resistant bacteria, making future infections more difficult to treat. Underlying medical conditions. Conditions such as diabetes, kidney stones, and structural abnormalities in the urinary tract can increase the risk of recurrent UTIs. Sexual activity. Sexual activity can introduce bacteria into the urinary tract, increasing the risk of recurrent infections. Hormonal changes. Changes in hormone levels during menopause can make the urinary tract more susceptible to infection. If you experience recurrent UTIs, it is important to seek medical attention to identify any underlying medical conditions or contributing factors. Bladder infections. A bladder infection, also known as cystitis, is a type of urinary tract infection, UTI, that specifically affects the bladder. It is caused by bacteria entering the urinary tract and multiplying in the bladder. Bladder infections are more common in women than in men. Can cause symptoms such as frequent urination, pain or burning during urination, urgency to urinate, blood in the urine, cloudy or strong-smelling urine, lower abdominal pain or discomfort. Bladder infections can be diagnosed through a urine test, which can identify the presence of bacteria and white blood cells in the urine. Treatment for bladder infections typically involves antibiotics to kill the bacteria causing the infection. Drinking plenty of fluids and taking pain relievers such as ibuprofen or acetaminophen may also help relieve symptoms. Kidney infections. A kidney infection, also known as pyelonephritis, is a type of urinary tract infection, UTI, that specifically affects the kidneys. It occurs when bacteria from the bladder or urethra travel up the urinary tract and infect the kidneys. Kidney infections are more common in women than in men, and are a more serious condition than bladder infections. Symptoms of kidney infections may include high fever, chills and shaking, nausea and vomiting, flank pain or back pain, painful urination, cloudy or strong-smelling urine, fatigue or weakness. Kidney infections can be diagnosed through a urine test and a blood test, which can detect the presence of bacteria and inflammation in the body. Treatment for kidney infections typically involves antibiotics to kill the bacteria. Hospitalization may be necessary for severe cases or for individuals who are at a higher risk for complications. Untreated kidney infections can lead to serious complications such as sepsis or kidney damage. UTIs in men. Urinary tract infections, UTIs, are less common in men than in women, but they can still occur. Men may be less likely to develop UTIs because their urethra, the tube that carries urine from the bladder out of the body, is longer than women's, which makes it more difficult for bacteria to reach the bladder. However, when UTIs do occur in men, they are often more serious and can lead to complications such as kidney infections. Common symptoms of UTIs in men may include pain or burning during urination, frequent urination, urgency to urinate, difficulty urinating, blood in the urine, pain or discomfort in the lower abdomen or back, fever and chills, in more serious cases. In men, UTIs are often caused by an underlying condition, such as an enlarged prostate gland or a narrowing of the urethra due to scar tissue. Treatment for UTIs in men typically involves antibiotics to kill the bacteria causing the infection. Experiencing at least one UTI in their lifetime. UTIs occur when bacteria enter the urinary tract and multiply, leading to infection. Thanks for watching. Kindle subscribe. Thanks for watching.